Welcome to the Swift Healthcare video podcast, exploring the intersection of healthcare and leadership, hosted by Dr. Patrick Swift. SwiftHealthcare.com is your resource for healthcare professionals to find coaching and consulting to engage, restore, and transform yourself and your organization. And now, here's your host, Dr. Patrick Swift.
Welcome, folks, to another episode of the Swift Healthcare video podcast. I'm delighted that you're here, and I have a fantastic guest for us today, Diane Powis. Diane, thank you for being on the show. Welcome to the show. Welcome to the Swift Healthcare podcast.
Thank you. It's an honor to be here, Patrick. Thanks for having me.
It's a joy having you here. And the show title, Advancing Women's Health, Change the Story with Diane Powis. And let me tell you about Diane Powis, a dear colleague of mine. Diane has worked as a clinical psychologist since 2001. She did her training at NYU Medical Center, the Rusk Institute of Rehab Medicine, and then she suffered through the postdoctoral fellowship in neuropsychology, rehabilitation psychology at Mount Sinai Medical Center. In neuropsychology, rehab psychology, I say suffered because she and I both went through the same program.
We survived
postdoctoral
together.
fellows, and the abuse and inspiration and training and outstanding training and all the wonderful stuff that came with that as well, right? But since then, Diane served as a rehabilitation psychologist, neuropsychologist at Stanford Hospital. And then she was at Greenwich Hospital, where she specialized in behavioral medicine. And here's where it gets really, not that that isn't significant enough in her training and the service she's done for patients and the community. But here's where it really gets interesting in the work Diane's done. Since 2019, Diane has served as the chief spokeswoman for the MAT, Marilyn Ann Trahan Charity Program, aimed at raising awareness for healthcare providers on how to better prevent and detect early-stage breast and ovarian cancers. And since then, in November 2020, Diane joined Aspira Women's Health senior leadership team as chief spokeswoman. And through her advocacy, storytelling, coordination, management of an ethnically diverse patient advisory board, she's working toward empowering women. All of us have benefit to that. She's working on empowering women to take control over their gynecological health by increasing their awareness of symptoms and understanding their genetic risks, and knowing that Aspira's life-saving biomarker tools exist. Diane Powis, Dr. Diane Powis, thank you for being here.
Thank you, Patrick. What a lovely introduction. I really appreciate that. And I'm really looking forward to our conversation today and trying to get the message out there. So thank you.
That's what we're doing. Absolutely. I'm happy to do it. So I'm going to give you the title again, folks. Advancing Women's Health, Change the Story with Diane Powis. Folks, I want you to bear in mind this is about women's health, but it's advancing healthcare in general. Whether we're healthcare leaders, we're healthcare providers, whether we're healthcare leader providers, or whether we support the work being done in healthcare, these are issues that we all at least need to have a working knowledge of. And I'm grateful that Diane's on the show to talk with us about it. So, Diane, if we could start with your journey of misdiagnosis to diagnosis and the relevance to what we're talking about here now.
Thank you. So yeah, my journey to diagnosis, I fortunately have been so blessed with a very healthy life up until age 45. I have a beautiful family, husband and children, 2 great kids. I'm working, as Patrick mentioned, at a very rewarding position as a clinical neuropsychologist, rehab psychologist at various hospitals. And suddenly, after my 45th birthday, I started to develop some strange new problems and symptoms. This period lasted for over 10 months overall. And the symptoms varied. It started with heavy menstrual periods with my gynecologist, and the symptoms ranged from pelvic discomfort and urinating frequently, again with my gynecologist, to lower back pain, to bowel problems, to just not feeling exhausted and just knowing something was wrong. What happened over the 10-month period is I was bounced from specialist to specialist, and the diagnosis of ovarian cancer was missed. And I was misdiagnosed with everything and anything from perimenopause to urinary tract infections, which the tests were negative, but the doctor said, well, it must be a false negative because you're so healthy. Nothing else would be wrong with you. This is by my gynecologist. Along the way, I was referred to a urologist because since the many antibiotics I took for my faux bladder infection didn't seem to help, he said, well, sorry, my faux urinary tract infection didn't seem to help. He said it must be a bladder infection. So he referred me, and this was a new doctor for me. He did his in-office evaluation, and he did an in-office scan, and I told him I was really worried. Something just felt wrong. And he looked me in the eye and he said, Diane, you're perfectly fine. And as I was leaving the office, I still wasn't convinced that, as he put it, I have an overactive bladder and just take these new pills and that will help me. I said, doctor, look, I really think something's wrong. In fact, it's not just my bladder. When I have to have a bowel movement, I'm having some severe cramping and pain. And he smiled, chuckled, looked me in the eye, and this is a direct quote. He said, well, that sounds like a gastrointestinal problem, so I guess I'm completely off the hook. So
I guess I'm completely off the hook.
Yes, I'm completely off the hook. And that was the end of that appointment and that interaction. From there, I saw my GP. She diagnosed me with diverticulitis because of the stomach pain and cramping based on an in-office exam, more antibiotics, after which those didn't help. I went to a gastroenterologist. She thought I had colitis. Ultimately, this is 10 months after my initial heavy menstrual periods where I had perimenopause. She had me for a colonoscopy to confirm the colitis. And I woke up from the twilight of the procedure and she stood over me and said, listen, I couldn't get the tube through because there was a blockage. You have cancer. So I was completely blindsided. Yeah, it was devastating.
Incredible. Incredible to be going through that months and months and months and months and months of seeing our colleagues in healthcare who go to work every day with the intention of doing good. But if we work in a siloed mentality and we think we're either on the hook or off the hook, then it's no longer putting the patient in the center of the care, but putting the hero as the center of the care instead of the patient. And that's backward. And that resulted in your journey there, Diane. And I'm so sorry you went through that experience. And that's why you're here. I mean, there's so much at stake because you're unfortunately, your story is not an exception.
No.
You're a spokeswoman. What's at stake for women here in general and those who love them, which should be all of us. We should all be supporting one another in this team human in women's health. What's at stake here?
Yeah. Well, what's at stake is women are dying. And even though it's not the most prevalent cancer, ovarian cancer is the deadliest gynecological cancer. Over 50% of those diagnosed die within 5 years. That's about the prognosis. The reason why is that, first of all, there's no screening for ovarian cancer. There's a common misconception among women, I think, and I'm not sure how much I knew about this myself, but that a pap smear protects you from ovarian cancer, which is absolutely untrue. A pap smear is a screening for only cervical cancer, no other gynecological issues or problems.
Yeah,
so
I didn't know that.
There's no screening. No screening ever existed and still doesn't exist, which is shocking given the state of science and what's been developed out there. Mm-hmm. Another reason for the horrific prognosis for these patients is that the symptoms are often considered vague and can perhaps be written off as other kinds of problems or not so serious. And I think both patients don't really know the symptoms or understand them. And many providers don't either, unfortunately. And, they call it the disease that whispers, and these symptoms whisper. But for me, in hindsight, having gone through this, I see them more as shouts than whispers, mm-hmm. and mm-hmm. things were just mm-hmm. missed. And again, as you so aptly put it, it's not just, this is something that happens over and over and over again to so many women.
Yeah, Diane, and I'd also argue that it can be described as whispers, but I'd also describe them as voices calling out to be heard that are being ignored.
Yes.
Right. And knowing the cardiac data on women more likely to die of a heart attack in a hospital than men because of how gender differences are perceived. It's astonishing and ridiculous that women are more likely, the data in disparities in care, even when you control for socioeconomic status, level of income, education, insurance,
yes,
women are more likely. So the heart attacks are missed. We need to be more sensitive. The ovarian cancers are missed. And that leads to your message here that's so critical. This is about ovarian cancer detection, but it's more than that. And I heard you you touched on the test itself. So I'd love to hear what your organization is about that you're spokesperson for.
yes.
And how they're helping being part of the solution. Folks, this is not an ad. Folks, Aspira Health is not a sponsor of this show. They didn't send me coffee or a Starbucks card or a sponsorship. This is not an ad. This is real conversations about what we can do to improve women's health. So that being said, what's Aspira Women's Health doing to help prevent? You said 50% of women mortality rate in 5 years.
Yes. In fact, and
Aspira Health is being part of the solution to reduce that and stop it. Yes.
Yes, absolutely. And that's the idea. The issue with this, with these misses, and I'll talk about Aspira in just one moment, but time is everything in this disease. And like so many cancers, the longer it festers and there's no awareness of what the problem is, the later you get in stages. And the 5-year survival rate, if it's caught in stage 1, is 90%. If it's caught in stage 2, it's 70%. Stage 3 and 4 are considered late stage. Caught in stage 3, your 5-year survival rate is 39%. If it's caught in stage 4, it's 17%. So clearly what's happening, and 80% of all ovarian cancers are diagnosed at late stage 3 or 4 because of what I'm talking about.
80% of diagnoses.
80%, yes.
As your journey was, Diane.
Yes.
And these numbers are not just numbers, they're people's experience.
Exactly.
Right?
These are women.
Yeah.
These are
women's experience. So, what's Aspira doing to help be part of the solution?
So Aspira's mission is to globally transform women's health, starting with ovarian cancer. Okay. And when they say women, they mean all women, all ages, stages of life, all races, ethnicities, socioeconomic status. They really are doing everything they can to treat all women the same and have their products available to everybody and remove some of the disparities that exist in healthcare for women, because they're out there. To the fact that they're chief spokeswoman, I think speaks to the company and their real desire to
a patient being you as the chief spokeswoman.
That would be me. Yes. Yeah. They really want to understand the patient's journey and think about, what's important as they develop their products and deliver them to the public, to providers, and they want to really be a support in that way. And I think that's quite unique in this world as a public company. There are a lot of healthcare companies out there that develop products and they forget that they're really treating patients. And this is about saving lives. And these are real women and these are real lives they're talking about. So
Amen to that.
Yeah. So what they're trying to do is develop comprehensive risk assessment products, tools that can be used. There's no screening tools, as I said, but the real focus is how do we take that 80% late stage and flip it and have women who, and a system where this can be discovered and detected at a much earlier stage. Because the saddest part of all of this, that women are dying, is it's preventable. It does not have to be this way. So
you're being a part of that. I'd encourage people to follow Aspira Health on LinkedIn to find out what they're up to. Again, they're not. There's no incentive for me to say that. Aspira Health is doing the right thing, and they're worth following.
So they've developed biomarker tools. These are protein biomarkers, and it's a simple blood test 1 in 5 women will have a pelvic mass at some point in their life. And with that pelvic mass, many will have to contemplate a surgical procedure to address the mass. What currently is the standard of care is to use the CA-125 biomarker. And it's a test that's been around a long time, but it's really insufficient. It does not pick up early stage disease for ovarian cancer. What they've developed is OVA1 Plus. They've done a tremendous amount of research with, large studies with large populations of women with pelvic masses. They've directly compared OVA1 Plus to the CA-125. And if you sort of did a meta-analysis of all of those studies that they've done, the sensitivity of the CA-125 is much lower. In fact, it's around 65% to pick up stage 1 and 2 early stage ovarian cancer for women with pelvic masses, whereas the OVA1 Plus is at 91%. So
OV1 Plus?
OVA1 Plus.
OVA1 Plus. Yeah, you lost me on some of the numbers there, but the OVA1 Plus is
what's
standing on. I want to encourage my listeners, if you lost the numbers, then remember the OVA1 Plus.
Significantly better than CA-125 at detecting early stage ovarian cancer for women with pelvic masses.
Incredible. Incredible.
So with that being said, also for Black women, the CA-125 is just known to be a poor measure. It's the numbers come out lower than for white women. There's a disparity there where it's not as good a measure.
Sensitivity is weaker.
Sensitivity is weaker for Black women versus the OVA1 Plus. That disparity doesn't exist between white and Black women. So
awesome.
It's another reason to think about, what to do. The problem is women aren't aware to ask for OVA1 Plus. Providers are very uncomfortable with making change sometimes, and they go with the standard of care because that's what they know. And they unfortunately miss a number of early stage diagnoses, and time moves forward. Aspira is also doing a lot of continued research. They're working towards further developing their OVA1 product. There's a lot of pipeline coming down with the research that they're doing to continue to monitor the women who have pelvic masses and also monitor women who have a high risk from a hereditary standpoint of ovarian cancer. The second that they have right now is called genetics with an X. And it's a very specialized genetic test for the mutations that could be connected to a gynecological cancer. So there are 33 potential mutations that are included in the test, and it allows women to really have the knowledge of their genetics. There's no substitute for that, because that's really the only way to prevent the disease is to know you have a genetic predisposition. And it's something, in my story, for example, I have a very significant history of breast cancer in my family. My mother was diagnosed at age 40. She died at 48. I have a number of great aunts who had breast cancer. Clearly, that should have rang a bell with any of my doctors over the years. I was very conscientious of I will not go down with breast cancer. So I was really vigilant. I was in a high-risk program, but I had no idea there was a genetic link between breast and ovarian cancers.
And if you'd known about the OVA1 Plus, and this also in the pipeline, the genetics test as well.
It's out. It's not in the pipeline.
Good. Okay, so we give enough love to Aspira and what they're doing.
Yes.
Focusing on you also, I want to talk with you about your experience, Diane. What was it like in finding your voice? You didn't just wake up one day and say, I want to be a spokeswoman.
No.
What was the journey like for you in finding your voice? And I understand there's a little book project type.
Yes.
So I'd love to hear about your finding your voice and this book you're working on.
Thanks for asking about that. Yeah, I think like so many women, I grew up in the 70s, but I think we're socialized a certain way. And my take on that is, how to be a good girl and how to be compliant and listen to authority and not necessarily speak up and be an advocate. And I feel like, there's that aspect of it for me. And I'm also an introvert and I'm a private person, and I have been my whole life. However, being faced with my mortality once I was diagnosed and recognized the severity of my situation, and that, I had a 5-year prognosis and 39%. So I sort of realized I had a choice. This was a crossroads for me. I could either, like a raft without a paddle, be pushed through the system as a cancer patient, and like I was bounced from doctor to doctor, just not take charge of things in a way that would give me some semblance of control, or start to speak up for myself and advocate for what I felt was best in terms of my care and all my treatments. And a lot of examples of that, but it really helped. And I think that translated ultimately to reaching out to others, realizing I'm not the only one with ovarian cancer, connecting to other women and learning how many of them shared a very similar story of late stage diagnosis that could have been prevented because of misdiagnoses, blowing off symptoms, attributing them to perhaps manifestations of stress. For example, one woman was given anti-anxiety pills and told, because her belly's just
extending,
so bloated,
and,
distended, she's, sick, just not feeling right. Oh, it's anxiety. So many stories that I realized, I'm not alone in this. And
you're not alone.
Even though my window has long closed for early detection, maybe there's something that I can do to facilitate change.
Yep.
And
if there's one listener that changes their behavior as a practitioner, or if there's one listener who is a partner and advocates for their loved one to go through this, get this kind of testing, or a potential patient themselves who may be brewing some ovarian cancer, to be aware of this. Yeah. And your lips to God's ears that this be heard, and so even just saving one life. But imagine getting this message out there more and more. So what's the title of the book that you're working on again?
Thank you. The book is called What's a Good Girl to Do? Records and Revelations of a Cancer Survivor. Do
you have a publisher?
I'm working on it.
All right. So we'll put that include in the show. Diane Powis, she's on LinkedIn.
Want to publish
she needs a publisher, folks.
It's an editing. It's with an editor right now.
Oh, okay. Well, still, let's get the word out there.
Yeah, the goal is to get it out there, though, and try to make a difference if I can and be heard. But women do need to know, and just the opportunities that came my way to speak up, I just couldn't say no.
Yeah. God bless you for doing that, and more power to you. And that is your call to action, for folks to act based on this information and save a life, and it may be your own or someone that you love. And so this may be a good time to ask you then, if you had an opportunity to speak to all the healthcare folks around the whole planet, you had their attention for a brief moment,
right?
Diane, what would you say to them?
Yeah, well, that would be incredible. I know how busy and overwhelmed a lot of healthcare folks are. I would say about a couple things. First of all, please, I know you're busy. I know you work so hard. I'm not saying, these are good people. These are people who've entered a profession to help others, and with all good intentions, do no harm, But I would say, please get educated. Learn about ovarian cancer, other gynecological diseases and problems like endometriosis. It's another one that's often missed, overlooked, shunned aside for women. They go years without knowing what's wrong with them. But please get educated, know the symptoms, know the early warning signs, learn about Aspira's products. I mean, if your go-to is the CA-125, if you have a woman with a pelvic mass who's contemplating surgery, please look into the Ova 1 Plus. It's FDA cleared. It's been around for 10 years now. So
save a life.
No excuse. Let's think about what better options exist out there. All the mechanisms are there. The technology is there. The scientists have developed this. Please take advantage of it. I would also say to my group of healthcare listeners, please, please listen to your patients. I know time is limited. Your schedules are busy. You know, the drive is to get through a lot of people. Maybe your waiting room is full and you know, you're just trying to get through your day and you have so much to cover. So when a woman comes in wondering, you know, if something's really wrong with her, if she's having these pelvic pains and discomfort, please stop and listen and think comprehensively. Try to get a full picture of what's going on, what brought her to you, what other symptoms and problems has she been experiencing lately? What other doctors has she seen? Coordinate care with those other doctors so that you're not operating in that vacuum of your specialty, because you're going to miss it. You're going to miss it. And it's so important to think comprehensively so that, you know, women have that chance, you know, that window of opportunity with early detection. They're not going to the gynecological oncologist at that point. They're going to their GP. They're going to the gastroenterologist, the urologist, the chiropractor. These are the folks that have the opportunity to catch it early. And it's just so important that they pay attention in a certain way, take a history, and also consider genetics for women. I think a lot of doctors think about genetics testing as a nice option sometimes, but it's essential. Knowing her genetics could make the difference between life and death and give her choices about prophylactic surgeries, ways to completely prevent breast cancer, ovarian cancer, and other issues and problems, and a lifetime of pain and suffering and medical uncertainty and real hit to the quality of life.
A passionate and comprehensive, full of heart call to action, folks. If you take one thing away, it's listen to your patients. The OVA 1 Plus, the genetics testing, the whole context, all of it. There's so much that you share, Diane. I'm so grateful for what you have to say and for your heart and your passion for this. And the takeaway to listen to your patients, and really it's to listen to one another, and also it's to listen to one another in the work we do. We need to care for one another, and the signs are there if we listen to our heart and listen to our gut and pay attention to it.
And use the tools available. And also, you know, it's about all the women in our lives. You know, I think about my daughter who has a 50% chance of inheriting my BRCA mutation. But it's not just about her. It's about all of our daughters, our mothers, our sisters, wives, friends. You know, the list goes on and on. You know, please think about what can be done for prevention and really change the story for women.
Changing the story. Here we go. We're talking about change the story. It's advancing women's health. Change the story of Diane Powis, Dr. Diane Powis. Diane, thank you so much for being on the show. It's been a pleasure and an honor, and thank you for your message and your heart and all that you shared. I really appreciate your being here.
Thank you for having me, Patrick. It's been a pleasure. Thank you.
Thank you for listening. Please subscribe, rate, or leave a review about the show on your favorite platform, and learn how to support the podcast as a patron at swifthealthcare.com, where you can also find the show notes and all of our episodes. Thanks for joining us.